Ebola virus disease, EVD, or Ebola hemorrhagic fever, EHF, is a disease of humans and other primates caused by an Ebola virus. Symptoms start 2 days to 3 weeks after contracting the virus. The Ebola virus was first isolated in 1976 during an outbreak of Ebola hemorrhagic fever in the Democratic Republic of the Congo, then Zaire. The strain of Ebola that broke out in the Democratic Republic of the Congo had one of the highest cases fatality rates of any human virus, 88%. The name of the disease originates from the first recorded outbreak in 1976 in Yambuku, Democratic Republic of the Congo, which lies on the Ebola River. The Ebola outbreak was contained with the help of the World Health Organization and transport from the Congolese Air Force by quarantining villagers, sterilizing the medical equipment, and providing protective clothing. The virus responsible for the initial outbreak, first thought to be Marburg virus, was later identified as a new type of virus related to Marburg and named after the nearby Ebola River. The virus may be acquired upon contact with blood or bodily fluids of an infected animal, commonly monkeys or fruit bats. Spreading through air has not been documented in the natural environment. Fruit bats are believed to carry and spread the virus without being affected. Once human infection occurs, the disease may spread between people as well. Male survivors may be able to transmit the disease via semen for nearly 2 months. To make the diagnosis, typically, other diseases with similar symptoms, such as malaria, cholera, and other viral hemorrhagic fevers, are first excluded. To confirm the diagnosis, blood samples are tested for viral antibodies, viral RNA, or the virus itself. EVD is caused by 4 or 5 viruses classified in the genus Ebola virus family. It is not entirely clear how Ebola is spread. It is believed that the Ebola disease do occur after an Ebola virus is transmitted to an initial human by contact with an infected animal's body fluids. Human-to-human transmission can occur via direct contact with blood or bodily fluids from an infected person, including embalming of an infected dead person, or by contact with contaminated medical equipment, particularly needles and syringes. Semen is infectious in survivors for up to 50 days. Signs and symptoms of Ebola usually begin suddenly with an influenza-like stage characterized by fatigue, fever, headaches, joint muscle, and abdominal pain. Vomiting, diarrhea, and loss of appetite are also common. Less common symptoms include sore throat, chest pain, hiccups, shortness of breath, and trouble swallowing. The average time between contracting the infection and the start of symptoms is 8 to 10 days, but it can vary between 2 and 21 days. Skin manifestations may include a maculopapular rash in about 50% of cases. Early symptoms of EVD may be similar to those of malaria, dengue fever, or other tropical fevers before the disease progresses to the bleeding phase. In 40 to 50% of cases, bleeding from puncture sites and mucous membranes, e.g. gastrointestinal tract, nose, vagina, and gums, has been reported. Types of bleeding known to occur with Ebola virus disease include vomiting blood, coughing it up, or blood in the stool. Heavy bleeding is rare and is usually confined to the gastrointestinal tract. All people infected show some symptoms of circulatory system involvement, including impaired blood clotting. If the infected person does not recover, death due to multiple organ dysfunction syndrome occurs within 7 to 16 days, usually between days 8 and 9 after first symptoms. Prevention includes decreasing the spread of disease from other infected animals to humans. This may be done by checking such animals for infection and killing and properly disposing of the bodies of the disease if discovered. Also, properly cooking meat and wearing protective clothing when handling meat may also be helpful, as are wearing protective clothing and washing hands when around a person with the disease. Samples of bodily clothing and bodily fluids and tissues from people with the disease should be handled with special caution. Medical workers who do not wear appropriate protective clothing may also contract the disease. In the past, hospital-acquired transmission has occurred in African hospitals due to the reuse of needles and lack of universal precautions. Airborne transmission has not been documented during previous EVD outbreaks. They are, however, infectious as breathable 0.8 to 1.2 millimeter laboratory-generated droplets. Because of this potential route of infection, these viruses have been classified as Category A biological weapons. Recently, the virus has been shown to travel without contact from pigs to non-human primates, although the same study failed to achieve transmission in that manner between primates. Recommended measures when caring for those who are infected include isolating them, sterilizing equipment, and wearing protective clothing, including masks, gloves, gowns, and goggles. Hand washing is important but can be difficult in areas where there is not enough water for drinking. Quarantine, also known as enforced isolation, is usually effective in decreasing spread. During the 2014 outbreak, Liberia closed schools. And in Nigeria recently, Ebola was discovered and we've had casualties. Now the advice is this: the international community should provide support on the most urgent basis possible. It is good news for Nigeria, as it has been reported that people are beginning to respond to treatment. Our advice to everyone out there is be Ebola conscious, wash your hands thoroughly, follow every step that is given towards prevention and not cure.